I'm Dr. Claudia Aguilera, back with another session of The Doctor Is In, Breaking It Down, the podcast where we break down medical issues so that it's easy for you to understand and make decisions for your everyday health care. Now, just to remind everyone, this is not medical advice, this is educational, and I hope that you enjoy our guest today. This is Dr. Lisa Magary.
Hello. Hi. I'm so happy to be on here. Thank you.
Yeah. Well, I mean, I love her model of healthcare. This is why I wanted to bring her on to talk about this. It's truly unique, and I think it's amazing for patients. And so, yeah, why don't you go ahead and tell us about your model and what started this?
Sure, yeah. So I have a direct primary care practice called True Access Primary Care. I had a practice like this in Gainesville for 8 years and then got bought out by my business partner and opened up here. And basically, I do anything you do at a doctor's office. So I'm a primary care. I mean, I do more than you generally get in a
Yes, we're sitting in an IV room.
Yeah. So I'm pretty much, I tell people I'm full service primary care. But how it's different is I do not depend on your insurance. Like, I want you to have insurance in case you need to get an x-ray or an ultrasound or see a specialist or go to the hospital. But to bill in my clinic, I don't want to deal with insurance because unfortunately, when you deal with insurance, you have to see too many patients and you don't get to spend the time with people that you really want to. So I got into medicine because I really want to take care of people, and working in a traditional model where you get 7 minutes a patient, you don't have the time to do any education, preventative. You're basically like, here's your complaint, here's your prescription, here's your complaint, here's your prescription. And I didn't want to practice that way. And I did for years, and it was really, really not ideal. So I saw this practice model in November of 2014, opened my practice in Gainesville, May of 2015 with a business partner, and we grew it to 2,700 patients. We had a total of 6 providers, 8 support staff, and it was super fun. We had a great time building it, and I knew they needed more of that here. There are a couple other direct care people in Palm Coast, and I'm friends with all of them. Like, we all get along great. There's plenty for everybody. And there are some that do more home visits than I would like to do. So if someone's more interested in that, I refer them on. But basically, people need good care. And when you are dealing with the insurance model and not getting more than 7 minutes a patient, and you sit in a waiting room for a long time, you sit in an exam room for a long time. And, you know, I've been educating people on this, like, oh, are you saying that we don't have good providers here? I'm like, oh, that's definitely not what I'm saying. I'm saying they're stuck in a system. We have great providers here. They don't want to spend 7 minutes with a patient.
Nobody does.
Right, that's not right. So,
and the patients don't like that either.
Well, no, they have to sit in a waiting room, and then they have to sit in an exam room, and then they get 7 minutes. And, you know, sometimes there's providers that spend more time, but then guess what? They're backed up.
Right.
So that means you're sitting in the waiting room longer because you know they're spending time with patients, and people are willing to make that trade-off, and that's fine. But I tell people I have a waiting room where no one waits. Like,
yes.
Your appointment's at 9, you come in at 9, my nurse Jamie brings you back, get your vitals, you're seeing me by 10 after 9 if we did that long. And then if my staff is busy, I bring you back into your vitals and start your visit. So it's really personalized medicine. And, you know, I've been lucky enough to kind of figure it out. We have an on-site pharmacy with wholesale generic medications. I have pricing with Quest that gets me wholesale, like, lab work. So sometimes even with insurance, you will have to meet your deductible before they pay for labs. It's a lot cheaper to get your labs here. So, for example, my daughter has insurance with her dad, and she had to get lab work done because she was on Accutane, and her lab bill came back $350.
Yeah.
And so I called my Quest rep, and I was like, how much would this have been if we had done it through me? And she goes, $31.
Wow.
So this is the system that we're in. And so I'm in the business of helping people and saving them money and helping them be as healthy as they can be.
It's such a timely topic right now, too, because all of the news about the insurance and what it doesn't reimburse. And of course, you know, patients, I think, oftentimes don't realize, you know, that we only have 7 minutes or we can't make a living.
Right,
and so
absolutely.
Then they feel like it's, oh no, so such a terrible experience. But I think it's important to notice that we don't want to be that way either.
No.
We don't want to be. And this seems to be such a great bridge, you know, to all of the issues that we're having. Mm-hmm. And I just love that you've been able to partner with labs and pharmacies to make the overall cost down.
Yeah, same thing with radiology. If someone doesn't have insurance, they'll give me a cash price, MRIs. So basically, I've just spent the time developing those relationships for the benefit of the patient.
Absolutely.
Right? Because I feel like they get the short end of the stick.
We do.
You know? And
and the providers do too.
Right. And it's when I tell people, I'm like, in the insurance model, the only ones that win are the administrators and the insurance companies. The patient doesn't win and the provider doesn't win. And we have great providers in this community. I feel bad that they're getting their butt handed to them every day. 30 patients a day, no time to have lunch, can't provide the kind of care that they want. So I just stepped away from that, and it's affordable. What you pay here isn't outrageous. I mean, it's less than your cell phone bill to have unlimited access. You can text after hours on the weekends when you're traveling. And we do a lot of extra things. Like you said, IV. We do the injectable weight loss with tirzepatide. And I'm very low and slow. You know, people want to lose all their weight in 3 weeks. I'm like, you've been this weight for, 25 years.
Right. You didn't put it on her.
Right. So we do a lot of education. We talk about, nutrition. We talk about movement. We talk about sleep. We talk about stress management. So it's a very comprehensive weight loss program. I have SoftWave, which helps with chronic pain, acute pain. It's a sound wave machine that's helpful. And then I also do hormone replacement. I do BioT, and then I do the troches or cream through a compound pharmacy that we have locally here. But the reason I started this is I was in Gainesville 25 years. I had 7 primaries and could not stand a single solitary one. And not because they were bad people, because they had 7 minutes and they would just look at my medical history and be like, oh, well, based on this and this is a prescription you need. And I'm like, actually, I just want you to check my thyroid. That's why I came in here. Yeah.
Or maybe talk to me about diet so I don't have to be on drugs.
Right, exactly. Or maybe your iron stores are low since you're, still menstruating. Like, there's all kinds of things that could have happened. When you come in with fatigue, they just want to write you, oh, you're depressed. It's like, well, I'm not actually depressed. I'm just tired. Can you help me? So I was like, I can't be the only person. And the funny thing is, when we opened, I thought it was going to be like middle-aged women who no one listens to, which we have a lot of. We had a lot of that. But the men love it. You know why? Because they come in and everything's done in one visit. Their labs are drawn here, their EKG's done here, their urine's run here, their exam's done here. Everything they need. If they need a medication, it's here.
That's so amazing.
So they don't go anywhere.
Yeah.
And they're like, this is it?
That's it. I'm done?
Yeah. And they're like, this place is great,
I certainly have people always asking me, well, here's a good primary care.
Yeah.
And I talk about her all the time, like literally. And I'll just be like, she can get your labs and she can get your medications and, she spends time with you. And I explain the model. I am always telling people this because I honestly think it's the best thing. It's like it's like practicing medicine the way it should
like
be.
old school.
Yeah,
right?
it's old school.
You train
exactly.
chicken eggs.
The way that we went to school to be.
Right, exactly. People go to school to help people, and in our system, it's just
not to be on the phone trying to get a prior authorization for 2 hours. I mean, I don't do primary care at my setting, so it's so nice to have someone to say, "Hey, go see her. This is a model that I love. I love for the patients. I love it for the providers. It's just, I think especially nowadays where there's so much frustration over healthcare, this is such a safe place to be.
And the expense of it, and people have insurance and they're afraid to use it, and I don't blame them.
Yeah.
Like my daughter got her labs, and she's 22, and she just didn't even think to try to use me for the labs because she had insurance, and her old insurance paid for labs. She didn't know she had to meet her deductible because no one tells anyone.
No.
So that's what I tell people. I'm like, I am the easy button for healthcare. Everything's transparent.
I love that. Easy button.
Anything you need, everything's transparent. I put in here. It's a safe space. You're going to know what everything costs way ahead of time. I have people come and they don't have insurance and they're like, I'm afraid to get labs. I don't know how much it's going to be. I'm like, it's going to be this much.
Right. And I know, it's right here.
And they're like, really?
What? Really?
The last time I got labs, it was $1,400. And they're just like, oh. And I'm like, I just negotiated the rate and I have low admin costs, right? I'm not 40 cents on every healthcare dollar goes to billing insurance. So I don't have insurance billers. I have people taking care of people here.
That's a statistic that I don't think most people know about. And I think that's important to highlight. 40 cents on the dollar to just collect
and fight and prior auth. All the insurance stuff is costing every practice 40 cents on a dollar.
That's ridiculous.
It's insane. And then why is that okay? Why has no one done anything? So, for me, I'm just like, well, I'm just stepping away and I'm going to take care of people how they need to be taken care of.
One of my favorite things to talk about why it's been so difficult for providers to provide the care we need is that I've heard that insurance reimburses $8 for a pap smear.
Right.
$8. Mm-hmm. Now, if you're a male physician, you have to have someone else in the room with you.
Right.
So you've got 2 providers in a room for how long that exam is, plus your equipment. And you got $8.
Right.
I've actually read that a lot of physicians stop doing pap smears and primary care because they can't.
They can't get paid.
No.
Right.
That's ridiculous.
Yeah.
So look at what we're doing to hurt people.
Right, and then they're having to drag them all over town, and it takes a little while to get an appointment, and then you can't.
Once you get your GYN appointment.
I do pass nurse here, but that doesn't cost any extra for the patient. They just pay for the labs request, which is, I think, $75.
That's amazing.
I do sutures here. I do derm procedures. I'll send biopsies. None of that costs the patient anything extra, just the cost of the lab.
The cost of the lab. And let's talk about a little bit about the membership. Like, what does that look like?
Yeah, so it's a monthly fee. There's no annual contract because I don't want people here that don't want to be here. There's a $100 monthly fee at your first visit. I do have corporate plans, but it's based on age. So if you're a kid with a paying adult, it's $30 for that child.
Wow. Per month?
Per month.
That's amazing.
Yeah. For adults up to age 51, it's $60 a month. 51 to 64 is $85 a month, and then Medicare age is 100% a month. And I don't bill Medicare. I'm very clear about that. I'm not to them, and the Medicare patients have to sign a waiver that says they understand that I am not affiliated with Medicare and that they're outside of their Medicare system. But yeah, so
but they can always bill it. They can always bill it.
They can. Well, there's no bill because it's not fee for service.
Gotcha.
So, but what I also encourage them to do, anybody with an HMO or on Medicare, go to your annual exam, because if we need something that only, because these insurance companies kind of put the lockdown on me being able to do some things, especially with not open access HMOs and Medicare plans. So, the Medicare doctors get so mad I'm stealing their patients. No, I'm not. I'm telling them to come to you.
Right.
I'm not. No, I want you to get your $700 or whatever you get for your Medicare annual exam. I want them to see you that one time. But I'm not going to be here on the back end when you can't get them in and you're sending them to the ER and urgent care, which, what?
I know.
You call in for a sick appointment, we'll see you in 3 weeks.
Yeah.
For the UTI, I'll see you in 3 weeks.
Yes.
You text me with the UTI, I'm like, come down, we'll run a urine, and I'll fill them out.
Get it done right now. So it's another great thing, too, to just be knowledgeable of the options, because I do a lot of telemedicine.
Mm-hmm.
And the most patients I see on telemedicine are people who can't get into their primary.
Right. I know.
And there are sometimes things that I cannot do on a phone call.
Right.
And then they get very frustrated, but what can I do?
Right.
I can't treat your chest pain on a phone call.
And then, and I do a lot of telemedicine. We do texting, after hours, weekends. And there are some things that I'm like, somebody has to see you. I need troponins. I can't get those outpatients.
Absolutely not.
Like, there are things that we have to do in an ER setting. But let me tell you, on New Year's Day, I got 3 people out of the ER. We found pharmacies open. I got them Zofran because they were, it's like
they didn't need ER.
They didn't need the ER. They just didn't have any access.
Right.
So when I gave them access, it kept them at home.
Yes. Right.
I mean, that's really what this is about access and care.
Exactly.
And a relationship.
And a relationship. Exactly. Whereas if you're in a practice where, again, they're seeing so many people a day, they don't have time to develop that relationship, and then they don't have time to fit you in when it's an urgency.
Right.
And I hear that over and over and over again. So, yes, I'm so thrilled about your model, and I tell everyone about it.
I love it, yeah. I feel very lucky that I get to do this, and patients get the care. And, I tell them, I'm like, I don't know everything, no clinician can.
No.
But let me tell you, my patients teach me things, which I will share with you. I am learning things every day that I will share. I know our bodies are the same.
No, they're not.
I tell people, I'm like, everything is an N of 1. Like, literally, like, in research, like, the N is 400 people. No, your body is you, N of 1. So something that worked for somebody else may not work for you. And the nice thing about my practice is I'm going to partner with you.
Yes.
Like, this is plan A.
Yes.
Ooh, we didn't get the outcome we wanted. Let's try plan B. Ooh, we didn't get the outcome we wanted. Let's try C. Oh, good. This worked. You know what I mean? Or A worked, and we don't even have to go to B or C. But it's that, crap, I go to my primary. I got one question I can ask. I'm not going to be able to get back in for 3 or 6 months. If I have a problem in the meantime, I have to go to urgent care.
Yes.
Why?
And that's another thing.
That is the
all the time, too. I hear all the time. I'll be like, this chronic issue, and you're talking to me about it. And I said, well, did you mention it to your primary care? I didn't have time.
I couldn't. They told me to make another appointment.
Right. Today is the annual physical.
Right.
We can only bill it for the annual physical.
Because if you
have an urgent appointment, you got to do that on next week. Like, you don't have appointments for 3 weeks.
Right. If you ask at that wellness visit and you have an ear infection, they bill you differently. And you have to pay a copay, which is supposed to be your free visit.
Right.
What? How did this happen? I mean, I feel like we're so misaligned.
We're so,
it's just sad for the patients. It really is. They just aren't getting what they need. And so I just feel lucky that I get to do that.
Yeah. And I think one of my goals here is to not only educate patients about that these models are out there, because most people have no idea
Yep.
But the other thing is to educate providers that these models work.
Yep.
I love the idea of being able to practice the way I had always envisioned it.
Right.
You know,
Like, oh, let's talk about your nutrition.
let's sit down and have a comprehensive exam.
Yeah, let's look at your skin and talk about the stress related to your husband or your wife or your
I
job.
think that's because, again, I think that it's so important to remember that you're a whole person.
Right.
And that maybe your pain is stemming from some stress.
Yeah.
And if we could sleep better and eat better and relieve some stress, that goes a long way to assist your pain. So I mean, it's important to spend time with someone and find out what's going on to really be that best practitioner for you. And partner, like you said, because it's not one size fits all.
No.
There are plenty of patients that this will work for and that won't.
Right. I mean,
You
look
know?
at research. Right, 30% placebo, same result. 30,
Exactly.
on an antidepressant, 30% have success with placebo and 30% have success with SSRI.
Right.
Well, what's really working?
What's right. Exactly.
You know, and I want people, if they're going to be on an antidepressant, to be in counseling, like,
Absolutely.
and be exercising, and be doing the things to get better, and not be on an SSRI the rest of their life. And some people need it, and I'm not taking those people off.
Right.
But if it's a situational, a divorce, or something super stressful going on with a child or a job, it's like, all right, we've got to get through this.
Right.
Let's figure out how to manage the stress. Let's get you feeling better so that you're able to cope with life. Let's get you sleeping. You know, those kind of things. And
Now, like
then-
you mentioned, you can't do everything here, so you've got some referral partners that you work
Absolutely.
with.
Mhm. Yeah.
Great. And they're all on board with the model as well, and I love that. I love that. Who are your favorite referral partners? So we've been talking with Dr. Lisa Magary at True Access Primary Care, and just wanted to let you guys know all about what she does here. I think it's so wonderful, and thank you
Thank
for
you.
joining.
I appreciate you having me.
It's so great. All right. Bye.